Welcome to the dental tutorial about the PerioAlign system, a periodontally purposed clear aligner orthodontic therapy which improves the health of the surrounding bone and gums while straightening the teeth. This is an informal informational video. I am speaking casually, but we live in an interesting world, to say the least. So to help keep things as copacetic as possible, please read the appropriate disclaimer. What is PerioAlign? It is a non-invasive and affordable alternative to gum surgery, traditional orthodontic therapy, dental implant surgery, orthodontic and wisdom teeth extractions, TMJ appliances, and elective orthognathic surgery. It is designed to have each patient achieve their as perfect as possible balance between the ideal arch form, proper occlusion, periodontal health, and aesthetics. Let's look at this 26-year-old woman. This is prior to the start of therapy. PerioAlign is all about the health of the gums. What we're looking at here is exposed necks of the teeth. Roots of the teeth are not being covered by the gums at all. In the top front of her mouth, it's difficult to distinguish where the gum tissue starts and where the teeth start. You can see some angry pointed tissue throughout the right side of her mouth on the top and bottom. On her bottom right, she had a gum grafting surgery at age 23. Let's look after 7 months of active therapy. You can look and notice that the gums are becoming less red, where the tooth ends and the gum starts in the upper front area is becoming clearer. There is certainly no increase in the amount of recession that she had in the backs of her mouth. It is stabilized and possibly improved. So after 7 months, this is what we refer to as gingival health level 1 of healing. Let's now look after about a year after 13 months. The gums are continuing to improve. Let's look back how they were after 7 months of therapy and how they were beforehand. So after about a year, you can notice that the gums are becoming even less red. Where the tissues were puffy, they're continuing to flatten out. They're adhering more tightly to the teeth and the bone. That's what we're looking for. Now after 19 months, the gums themselves, they're continuing to look less red. In every aspect of the mouth, the tissues are now becoming more firm. They're fuller. They're maturing. The gum tissue is healing to the point gingival health level 3 has now been achieved. Let's fast forward to 2.5 years after active therapy. Are we maintaining gingival health level 3? Look at how beautifully the gums now are sculpting around the teeth. They've matured magnificently. This patient has done so well that you could notice that there's very few areas which you would suspect might have been troublesome earlier on. So what are the goals of PerioAlign therapy? We want to idealize the arch form. We want to idealize the bite. We want to improve the health of the gums. We want to reduce the likelihood of orthodontic relapse. This is so important, I'm going to read it again. We want to reduce the likelihood of orthodontic relapse and all the consequences that come with it. We also would like to create straight teeth. Let's look at her smile. Even though the gums took about 1.5 years to look stunning, her smile, this was the result after 7 months. This happened quickly. So let's see some of the successful results. Her periodontist confirmed that her mouth has healed so nicely. The same one who felt she would need 4 additional surgeries in addition to the one he performed in the lower front of her mouth, there is no longer a need for any gum grafting surgeries. Her periodontist and general dentist alternate cleanings. She has a professional cleaning every 6 months. Prior to PerioAlign, she required a periodontal cleaning every 3 months, 4 times a year. She's now down to 2 examinations and cleaning each year. Her gums and teeth are no longer sensitive. Her mouth has been free from orthodontic relapse for more than 3 years. I am Dr. Elliot Davis. I am the inventor of the PerioAlign system and the Manhattan method for teeth whitening. Dozens and dozens of patients have been successfully treated with these methods. Should you have any questions, please contact the office. We will be happy to take wonderful care of you.